What do you think? Isipin nyo, ano kaya? Ano ba yung edad ng pasyente? Di ba inaral natin sa growth and development, there's what we call the chronological age and then there's a dental age. No? Ano sa tingin nyo? Edad ng pasyente, yung totoong edad niya. With respect, no? Kung titingnan mo yung dentition ng pasyente. Ano sa tingin nyo ang edad niya? How is the dental age to estimate considering the root development of the upper and lower incisors? Okay. Nandyan pa ba kayo? Nag-iisip ba kayo? No? Because this is very important. No? With your diagnosis, kung anong diskarte na gagawin nyo. No? Kung titingnan nyo, 8 years old na yung pasyente. Pero ang dental age niya, ilang taon? Okay? Late. Tama? So, the determination of age is difficult if you will just base on the radiograph. It's often a problem with X-ray because the varices do not show a uniform state of development. That's why if hawak mo, ano ba yung dental age ng pasyente? O sige, ano na to, 8 years old. Pero hindi eh. Kung 8 years old siya, dapat nandiyan na yung ano niya, yung first permanent molar niya on the right side. Okay. Hindi uniform yung development. This becomes obvious when comparing the roots of the lower and upper central incisor and those of 34, 35 in contrast to 1,4 and 1,5. Observe ninyo yung mga roots. With reference to the root development of the lower central incisor and first molars. The dental age is 8 years. No? Is in correspondence to chronological age. However, with respect to the upper central and lateral incisor, showing less than half of the root length, and the lower second molars, no root can be noticed in this teeth. The age might be rather be fixed at 7 years or even younger in 1,5 and 3,5. Meaning to say, kahit na kung ang papagbabasihan mo yung the first permanent molar on the other side, no, the patient can be chronologically and dental age 8. Pero kung titingnan mo yung mga ibang ngipin, hindi. No? Younger. No? 7 years or even younger in 1,5 and 3,5. No? Most striking is the undermining resorption of 5,5 with impeded eruption of 1,6. A resorption lacuna can still be noticed in 65. However, 26 is aligned normally. Kung makikita nyo on the other side, no? Yung 65, may resorption. Pero at least naka-erupt yung first molar niya on her left side. Okay? Actually, this is very basic. Naturo ba to sa orthopedo? Naturo ba sa college sa orthopedo? So, due to the primary lack of space in the upper front, compare panoramic film in 1989, under the same patient, no, undermining resorption na occurs in 53, 63 with marked delay of eruption of the lateral incisor, undermining resorption 55 and has increased in comparison in 1989, and hence 16 has not yet erupted completely. Okay, mga doctors, pag nakita nyo ganyan, may mga undermining root resorption, lagi nasa isip nyo, nade-delayed na ako. Sa mga susunod, ituturo ko sa inyo ano ba yung consequences if there's delayed eruption, hindi sabay. Usually pa nag-erupt yan in pairs eh. Di ba, Doc Alea? Most especially the molars. Kaya pag nag-erupt yung sixes, halos Nagsasabay-sabay sila. Pero this one, ang tagal. So what do you think will be the consequences of this? If you, as the general dentist, na dun sa yung pasyente na yan, yung mami tiwalang-tiwala sa'yo, na dinala yung anak mo, nag-refer ka ng panoramic, pero hindi mo binasa. Na later on, ang lalala na nung ngipin ng anak niya. Ang dami kong cases na ganyan, na lumipat talaga by pamilya. Word of mouth yan eh. Kasi bakit na-overlook? Napaka-simple na this is very basic that should be taught in undergraduate. No? Na yan later on, grabe yung malocclusion. You can see the 4-6, no? Observe mo yung 4-6. Kung iko-compara mo sa level ng 3-6, because 4-6 so already super erupted, no? At yung kanyang 1-6 kasi hindi pa lumalabas dahil nai-impede noong decidus. Why? It's very remarkable that there's already an ongoing, no, space problem or crowding. Okay, na dapat meron ka na inilagay dyan. No? Meron ka na inilagay dyan, hinihilot mo na yung buto habang lumalabas yung mga ngipin na yan. Kung yung design mo, Doc Alea, na appliance, meron kang occlusal cover, mape-prevent mo yung first permanent molar on the right side mag-supra-erupt para hindi pumaling ang muka ng pasyente mo. Okay? Kasi po pwedeng pumaling ang mukha ng pasyente pag ganyan ang occlusal plane na hindi na nagbabalance. Yan yung mga nagkakant. Later on, makita mo bakit mataas yung isa. Pag ngiti, puro gums dito. Dito sa isa, walang gums. No, nakakant na. Kasi nga, hindi nakita to. So it's a red flag. Pag nakakita kayo ng undermining root resorption, you have this impression that this patient might be having a crowding, future super crowding tendency. Okay? And this is a generalized disorder of resorption. No? The reason for generalized resorption disorders of primary teeth is often unclear. However, genetic factors and hormonal influences on growth play a crucial role in many cases. That's why you should include, no, the general health ng pasyente. Pag nakita mo yung bata, ay, sa edad niya na to, parang maliit siya, tapos payat siya, tapos parang pihikan, tapos pag kinausap mo, parang delayed, no? So, kailangan, titingnan mo lahat, no? And it can be seen dun sa ngipin niya, no? The retardation of resorption is characterized by discrepancy between the reduction of the primary tooth root and the ongoing root growth of the permanent tooth in a regular position. A general backlog of resorption may result from fluoride application during infancy and childhood. Sumobra naman, no? Sumobra naman. Okay? The patient example, no, presented for generalized resorption disorder shows a marked delay of tooth development and eruption as early as on the initial radiograph taken at the age of 9. Okay? Sumosobra naman. Okay? So, this is another problem. Okay? So, teeth deciduous teeth can also be ankylosed. So, nakita nyo, nag-erupt na. Nagpa-appliance sa iba yung pasyente. Akala mo, Doc Alea, it's because of the appliance that impedes the vertical height in the deciduous molars. No? Nung pala, may ankylosis. No? In this context, no, means that fusion of dental hard tissue cementum and dentin with alveolar bone, with accompanied by loss of soft tissue. In most cases, however, it does not involve the whole periodontal ligament, Single bone bridges in the periodontal ligament suffice to disturb the normal